From Lagos, Nigeria, this is News Central. I'm Felicity Ezewike. The top stories tonight. Talks ongoing as federal government intervenes in feud between Dangote Refinery and PENGASSAN, with nationwide strike still in force. Chief Justice of Nigeria swears in 57 senior advocates, tasked New Silk to uphold judiciary tenets. President Donald Trump and Benjamin Netanyahu agree new U.S. peace plan for Gaza, one Hamas to accept proposal.
And in business, Nigerian Civil Aviation Authority eyes China's C919 jet certification for domestic carriers.
And in sport, FIFA finally deducts 3 points from South Africa, blowing race for the 2026 World Cup group qualifiers wide open.
A warm welcome. Tonight begins now. We'll begin tonight with a crisis in Nigeria's downstream sector. The federal government has commenced reconciliatory efforts amid the feud between the management of the Dangote Refinery and the Petroleum and Natural Gas Senior Staff Association of Nigeria. Speaking at the meeting convened to bring lasting peace, Minister of Labour and Employment Mohammed Dingyadi says that the federal government is exploring all avenues to resolve the impasse in the interest of national stability. In attendance with the Minister of Finance, Wale Adu, alongside senior government officials and other critical stakeholders in the oil and gas sector.
That PENGASSAN is on strike, and a very serious one for that matter, because I never knew that they have closed NNPC itself and other subsidiaries of oil and gas industry. I think, I don't want to make any judgment, but we didn't know that this is the magnitude of this strike. So we're thinking that they're just dealing with Dangote, but I don't want to believe that the target is also the government of this dear nation. We know PENGASSAN, they have always been very peaceful. And we know for a very long time they have never done this kind of thing. And we consider them as friends and people who wish this country well. We also have the same feeling for Dangote Group. They have been contributing to the economy of this country, and they have been doing very well in terms of relationship and business relationship with the government of this country. So we want to make sure that what is happening now is not extended.
Dr. Godwin Ihetu is a former Group Executive Director at the NNPC. He joins me now for a conversation on the ongoing impasse in the downstream sector. Thank you for being here tonight. The federal government has come out via the minister to say that, they will not allow the situation to escalate into a national crisis or some sort of emergency. He also said that he did not know that the situation, I'm just paraphrasing now, degenerated to get to such a strike, but they are on top of it. What reassurances do you think Nigerians should take from those comments, seeing that this feud has been in the public space for a while?
Well, I think it was the minister who just said they didn't know that the matter had escalated to this point. Really, one knew that there was already a dispute going on, and between the union and the Dangote company. The point here is that over the last week, one has been watching the, shall I say, disagreements that one could saw on television, where we were told that members of PENGASSAN joined the, or rather, the employees, some employees of Dangote voluntarily joined the joined PENGASSAN, and PENGASSAN had already also notified Dangote of the people who joined PENGASSAN. What is not clear is what happened thereafter, because the next thing we heard was that 800 members who happened to be those who joined PENGASSAN, 800 members of staff of Dangote were disengaged. And following that disengagement, the PENGASSAN protested, but in response, Dangote company insisted that they were doing a restructuring of the company, and that was why those people were disengaged. So really, one is not too sure how this process happened, and one is not sure of how the communication between the two parties went. But as of yesterday, one suddenly saw that PENGASSAN was going to ask its members to withdraw services nationwide, virtually.
All right,
and that's why we have been, sorry?
Yes, I was just going to interject and ask you, the government intervening at this time and saying that they will not allow it to escalate, whereas the NLC has put its unions on and its members on alert. The TEC saying they will join in. They are asking Dangote to apologize and reinstate the 800 workers. And we know that today alone, there has been some economic loss for the country. How speedily, as at press time, as at we're coming on air, I don't think there's been an outcome in the meeting between the government and the representative of this association. But how speedily do you think the government can resolve this issue, which has festered for a while?
We have an emergency, obviously. The government must make sure that this situation ends today, because the magnitude of what is happening now is sufficient to paralyze quite a number of oil operations across the country. So it is very, very important that the government intervenes firmly today and to ensure that there is, in fact, agreement on the oil operations continuing tomorrow. Should not go beyond today, because the consequences can be there.
Paint us a picture as to what we're looking at, a potential fuel disruption and the broader economic instability that might result from this situation if the federal government does not come out of that closed-door meeting with some real solutions.
Well, what we heard in the media is that PENGASSAN has asked its members not to continue operation, that they should stand down, which means gas supply, for example, from the Delta, the major gas line we have in the country, from Escravos to Lagos. If what we're hearing is what is happening, it means that that system will be shut down. They will not have gas. And companies like AB, which is a gas generating company, will not have gas to be able to generate electricity for distribution, not only in the Lagos area, but I presume also injecting into the national grid. And this may also happen with other GENCOs around the country. I understand that those GENCOs are also affected. Those GENCOs that need gas to generate power will also be affected. And one is not too sure about the downstream side, petrol and diesel. I heard the president of the TUC yesterday talking about the fact that Dangote Refinery has its so many days of storage of fuel, and therefore there should be no fear of shortage of fuel in the country. But I don't know how realistic this is, and whether in fact we're not going to get more problems from this situation.
We already know the side of the unions in this matter, and of course Dangote have come out to issue a statement. The consequences are clear if the matter is not resolved. But I wanted to ask you about the side of Dangote, who seem not to feel like they are doing any ill. They've come out to accuse Pengassan particularly of trying to sabotage the oil and gas sector and promote the interest of their leaders per se. They made other accusations as well. How do you look at Dangote's reaction, the body language they're putting out? Is this a fight that they really want to embark on? They've even gone to court, lest I forget, to take an injunction to stop the strike that isn't working. Is their reaction escalating the matter?
Well, I suppose, nobody can have an investment like that, and an industry like the petroleum industry, where you need to have constant flow, whether it is gas, crude oil, or petroleum products, and then allow it to be halted, even for 1 hour. Therefore, it is not surprising that Dangote is putting up a fight. But really, what is intriguing is the fact that all these matters should have been sorted out, during, say, the last week, before we came to this crisis point. And I think there should have been enough time for proper dialogue between the parties. And at the worst case scenario, one was expecting that even if there was going to be a strike called, there should have been ample notice. I don't know what is ample notice, week or what.
I guess it's left for us. Yeah, I guess it's left for us to wait for the outcome of the federal government intervention, and hopefully they don't stall things for the country. Thank you very much for speaking with us, Doctor.
Thank you. Pleasure.
Staying in the downstream, fuel stations across Abia State on Monday remained operational, even as the Petroleum and Natural Gas Senior Staff Association threatened withdrawal of services. In Umuahia, the Abia State capital, consumers were seen entering filling stations and purchasing with ease at no additional cost. Passengers of commercial vehicles and drivers also confirmed that the fares are still the same, saying they were unaware of the proposed strike. However, some welcomed the strike as a way of getting the attention of the authorities to do the people's demands.
Our headache can strike at all. The normal price I only understand here now.
It's the same price. Very convenient.
There's a lot of things going wrong in this country, and it was not supposed to be so. This energy regime, petrol, gas, these are things that the common Nigerians should have access to.
Coming up, federal government makes thesis submission requirement for NYSC mobilization. We will bring you this story and much more when we return. You're watching tonight on News Central. A reminder of our top stories. Talks ongoing as federal government intervenes in feud between Dangote Refinery and Pengassan, with nationwide strike still in force. Chief Justice of Nigeria swears in 57 senior advocates, task new silks to uphold judiciary tenets. And President Donald Trump, Benjamin Netanyahu agree new U.S. peace plan for Gaza, warn Hamas to accept proposal. Thank you for staying with us. The Chief Justice of Nigeria, Justice Kekere-Ekun, on Monday swore in 57 legal practitioners as senior advocates of Nigeria at the Supreme Court complex, Abuja. Among those elevated was Adedayo Adesina, a legal practitioner, reform advocate, and co-founder of Oyewole and Adesina, whose career has been marked by excellence in advocacy, judicial reform, and public service. Speaking during the special session of the Supreme Court marking the commencement of the 2025-2026 legal year, Justice Kekere-Ekun described the conferment of the SAN rank as a moment of solemn reflection and renewed commitment to the noble calling of justice. She urged the new SANs to uphold the dignity of the rank, warning that the privilege could be withdrawn if abused. The Federal High Court in Abuja has declared the proposed shadow government announced by Professor Pat Utomi, a political economy professor and former presidential candidate, unconstitutional and uncommon to Nigerian law. Delivering judgment on Monday, Justice James Omotosho barred Utomi and his associates from going on with the plan, which its proponents said was an initiative for holding the Nigerian government accountable. The judge held that the idea was inconsistent with the country's presidential system and could mislead citizens. He ruled that Nigeria's constitution does not recognize any parallel or alternative government. The dispute between the State Security Service and Utomi began after the agency sued him over his plan to form a shadow government, describing it as unconstitutional. The SSS sought to stop him and his associates from pursuing the idea. Now, let's tell you about the NYSC mobilization. President Bola Tinubu has approved a major reform, making compliance with the national policy for the Nigeria Education Repository and Data Bank mandatory for all National Youth Service Corps mobilization or exemptions. The directive issued by the Secretary to the Government, Senator George Akume, requires proof that all prospective corps members have adhered to NERD rules, regardless of where they studied. This reform aims to curb certificate fraud and misuse of academic awards by demanding the submission of academic work such as thesis or project reports as part of the compliance process. The policy also serves as a quality check on continuous academic enrollment and affiliation. On October 6, no Nigerian graduate will be mobilized into or exempted from NYSC without verifying adherence to NERD. Yes, indeed, we are counting down to October 1. Health, they say, is wealth. But how much of this wealth can Nigerians boast of today? The nation's journey in the health sector, as in several others, has been marked by inadequate funding and policy inconsistency. New Central's correspondent Sumaya Abubakar in this report examines how this critical sector has evolved in the 65 years of our nationhood, in continuation of our assessment of Nigeria's developmental strides since independence.
Nigeria inherited a very limited health infrastructure, few medical schools, hospitals largely in cities, basic diagnostic tools, limited access in rural areas. Over the decades, there was significant expansion of more medical schools, from just one in 1960 to many today. Establishment of the University College Hospital Ibadan as a center of excellence, introduction of modern diagnostic tools, the ultrasound, CT, MRI, and national policies to improve immunization and control of diseases like malaria.
When I reflect on the Nigeria we envisioned at independence, And even more so during my years of service in government, healthcare was never meant to be a luxury for the privileged or the urban elite. It was to be a fundamental right.
We had the good luck of having late Professor Ransom Kuti, who gave life to primary health care and made it a benchmark and made it a place to go. At that point, we knew that our immunization coverage was high, double digits, and interventions were working at that level.
There are no doctors who want to go there because the motivation to go to this underserved environment is not there. Even those in urban settlements, the government is not remunerating them the incentive to doctors there.
Even as Nigeria's health sector grew, recurring crises have tested it, from epidemics to industrial unrest. Health workers have frequently gone on strike for better pay, improved working conditions, and welfare. In the year 2000, resident doctors struck for 3 months over salary arrears and working conditions. In 2021, doctors under the National Association of Resident Doctors, NARD, began an indefinite strike over unpaid allowances during COVID-19. Most recently, nurses won in strikes over pay and staffing issues ended in agreements but reflect ongoing tension.
Industrial disputes or industrial disharmony has the potential to cut short the progress of work within the health care system, because within that time frame, there is likely going to be complications as a result of patients who are seeking health care in the facility, in a public health facility, not being able to meet with doctors.
Before, we have a lot of staff available to attend to patients, but these days you can see that we have limited staff in various wards.
Today, maternal mortality remains very high, over 1,000 deaths per 100,000 lives births in recent years. Many Nigerians in rural areas still travel long distances for care. Some public hospitals are understaffed or lack essential drugs, while programs like the Midwife Service Scheme have tried to bring skilled birth attendants to remote communities. Many infrastructure and funding challenges persist.
Millions of Nigerians still walk miles to reach a health post. Still, many die from preventable situations and conditions.
Matsalan da muke da shi, an samu ci gaba na yawan asibitoci, an samu ci gaba na yawan likitoci, amma an samu failure ko rashin ci gaba wajen biyan likitoci.
This national health insurance scheme that they registered us, if you have any cause that you are drugged past 1,000 naira, they will refer you to their clinics or hospital. You should go there. They don't have in stock.
They should develop the villages so that they will have more improvement in doctors. In some hospitals, they will have like primary health care close by. In case of anything emergency will come, they can help.
Nigeria's health story at 65 is one of meaningful growth and also recurring setbacks. Strikes, underinvestment and access gaps are as much part of the story as immunization and emergency responses. The health experts and everyday Nigerians agree sustainable funding, better infrastructure and trust built through consistent service are key to the next chapter. In Abuja, for News Central, Sumaya Abubakar.
Many thanks, Sumaya. To help us take a retrospective look at the health sector, especially in the last 2 years of President Bola Tinubu, we have joining us a medical doctor and social rehabilitation expert, Dr. Oludare Maridoti. With him is the Lagos State Chapter Chairman of the Nigerian Medical Association, Dr. Sakid Babajide. Gentlemen, thank you very much for being here. Let me start with you, Dr. Babajide. give us an assessment of Nigeria's health sector as it is currently, especially in the last 2 years of President Tinubu's administration.
Thank you, viewers. Thank you. The health sectors have not really improved so much. It's like the inflation they are talking about, reduction in inflation. And what happened in inflation, you just have a slow lowering of inflation. Not that there's a drastic reduction in inflation. The same thing is going to happen. The same thing is happening in the health sector. There are no significant improvement in the health sector from this administration. And they have shown that the health sector is not a priority of this government. And in the sense that we have had several strikes, the health sector, and also the health delivery is not something to appreciate, because like the health insurance is still low, like 5%. There's no improvement. Healthcare delivery is still low. That's why people still go outside the country to get health service. Even in this country, we know that the former president, the past president of this country, former President Buhari went outside. The former head of state, General Absalam went outside, and TRC is still going outside. Even the president also, President Tinubu also will go for vacation, go outside. It's unfortunate. It shows that there is no improvement in the health sector, and there are no indices that show that such improvement. And we are still at the same level. That it's not growing. And unfortunately, the government is not looking at what are the causes, what are the challenges, and how to resolve the challenge. What we hear the government is doing is just to commissioning some element project, which may not have much effect on the healthcare delivery. They do more of things that relate to international partnership, researches, and data. That's not the thing we need more. We need data, we need research, but the main thing that we have fed the healthcare delivery to the citizen, that's the most important thing, which the government have not really done.
All right, Dr. Maridoti, let me... Dr. Babajide talked about commissioning of projects may not have much impact in the sector. That's assessing this administration still. I want you to take it from that angle. Investment in the sector. How has this administration utilized the increased budgetary allocation to the sector to improve in infrastructure and services across Nigeria, particularly in the rural areas, and welfare of healthcare practitioners?
Yeah, thank you very much. We cannot talk about 65 years of healthcare and focus just on the last 2 years, right? So it is a long-term decadence, and it is also something that, a 2-year investment, while it might go further, even some of that money might have not been fully, exhausted. So, yeah, some of the projects might not seem to have been reflective. But when we want to look at the problem of healthcare in general, we have to look at it from a global point of view. It all started in 1966, I believe, when the federal government decided to federalize all the, teaching hospitals and universities that we had, which meant that there was so much control in the center, and then the people in the respective, regions and the hospitals lost control, and they lost administrative, direction of their. That was actually the primary thing that that caused the problem. Infrastructure is something that we definitely need. There is a dearth of infrastructure in our health sector, but it will also take time. We have to understand that it's only a percentage of the GDP that the government can invest, right? And so if the GDP is small, if the country's economy does not grow, we are going to have very limited amount of money that we can invest in health sector, in building infrastructure and all of that. But one thing that is also beleaguered our health sector is something that Dr. Ranka also can allude to, which is the issue of the number of medical doctors. My father was also like the NMA chairman in Ondo State in 97, 98. And back then, the schools, the universities decided the number of people that they could admit. And yes, we know that the infrastructure in those universities were not enough, but from the concrete, the rose petals were growing and we were thriving. We had the numbers. But about when I was in part 3, I think 2008, 2009 set, I heard President Obasanjo talk just now. I believe the negotiation started during him, and Dr. Lainka will be able to say more about this because I was in medical school then. They decided to start to gazette or, to reduce the number of medical students that, not just medical students, doctors, nurses, pharmacists, all of them, that each universities can admit. That is 18 years ago right now. So imagine the fact that my set was 300 students, but after then it was about 100 students, and not all of them will still graduate. So we have undertrained for about 20 years. The doctors, we have not done it at the rate. Maybe not, let me not use capacity, but at the rate that it used to be. So should we be surprised that we don't have doctors and nurses right now to attend to patients? And this is one thing that the administration, I have to give kudos to Ali Pati, because not a lot of people were focusing on this. He actually tried to, pull it back, but I believe they've not even done enough. I know there's a case of some people in Calabar that they are still trying to say they were illegal, even though they are passed. So these are some of the problems that the situation has faced. And also a major problem in infrastructure that we have to talk about is the fact that the federal government is also funding inefficiencies. All our federal government-owned hospitals are inefficient institutions. The federal government guarantees their income, but there is no key performance indicator for them to follow. There is no enforceable, deliverables. Right. So the federal government does not focus on any of the private sectors who are the ones that might, train in these places and move to the local areas. They don't get enough funding. NHIS is nothing to write home about. It is essentially moribund. So these complicated situations would have caused the problem. So we can't fix it in 2 years. That's what
Joe, we can't fix it in 2 years, but something can be done. And I mean, on October 1, the president is expected to give the country some, assurances and, maybe explain some of the things he's been able to do in the past 2 years. Election year is just around the corner. So this is, as much as it is a review of our history, it's also an assessment of what could have been done. And that was why I referenced the fact that Dr. Babajide talked about the commissioning of some projects, and I'm wondering how that is, helping the case of their interest in the health sector. But because of time, I'll just ask Babajide, from the report that my colleague gave to us, Maya, one of the respondents talked about the NHIS that you mentioned, how it is being used, how sometimes when they go there, instead of giving them the drugs, they tell them they don't have it in stock as an excuse for them to go out and get it. What is your thoughts on how government can make it more accessible for people so it doesn't look like it's, the more you look, the less you see?
Yeah, thank you, unfortunate people. If you look at this NHIS and the Lagos and all the states that are doing this, they focus more on the civil servants. And when you see the formal sector and the informal sector are not really being used to get this NHIS, because the main basis of the health sector now all over the world is to get health service out of pocket. That's why they want to make it compulsory. But what they're supposed to use, they're not using it. For example, NHIS has been the same thing from the time they started. They don't improve it. And they are saying they don't drop. How can they have drop? When the budgetary allocation to health, you are still at the level of 4 to 5%. And there's an Abuja declaration of 2001. How many years ago? About 24 years ago. That the declaration of 15%. And that means that the health financing is poor. And who is going to get those drugs? It's not the government will provide the necessary monetary allocation for them to get the drug. For example, the health premium they are giving people in terms of this health care is simple. It's like for example, give example of malaria treatment. The health provider, how much are they giving them? The people to buy anti-malaria at about 3,000 or 4,000. How much are they give them the premium? Even the amount they are giving them, you cannot treat malaria. to talk less of treating anything.
There is indeed a lot of challenge in that area. We're time constrained, otherwise I would want to, I'm sure our viewers would also want to listen more. But let's quickly give Dr. Maridotu at least 40 seconds to take on 2 critical areas that you think this administration can take on in the next 2 years or before the administration ends, depending on what the outcome of the next election, to make an impact in the sector?
Yes, the first of, you cannot build a skyscraper on a quicksand. They need to change the structure. The federal government has so much control. There was a strike in my alma mater last year where people were sacked because if you want to employ people, you need to go and get permission from federal government. The federal government needs to get into the business of financing healthcare and not controlling hospitals, which is also what Dr. Olatunji spoke about. If they can do that major restructuring, the investments will come, with time. As our GDP gets better, we will have more money to get, into healthcare. Like Yoruba people will say, the money you don't have, you can't spend it on your diarrhea. So we need to make more money first, but they need to restructure so that money, when it comes, it will be properly and efficiently used. Thank you very much, doctors, for speaking with us. We appreciate your time. Still ahead tonight, dozens arrested in Morocco Gen Z protest. This story and more after the break. Thank you for staying with us. The hospitality industry is undergoing a transformation in 2025, with technology, culture, and guest experience taking center stage. At the Hotel Expo Nigeria 2025, convener and founder of Hospitality Expo Nigeria, Johansson, says the focus is on helping guests savour the human experience even while away from home. News Center's Victor Mbadike reports.
It is the 6th edition of Hotel Expo Nigeria, a platform aimed at repositioning Nigeria's hospitality industry. Stakeholders from across Africa have gathered to chart a new direction for hotels and tourism.
This partnership is also a big part of hospitality, and that's what we also push as well. So at the end of the day, people would see need to partner, to connect, to be able to work and leverage on each person's strength. I'll give you an instance. A hotel might be in need of a tech company to do something for them ahead of the dirty December period. So this is where they can align and say, oh, you know what, let's talk about it. And this is where you break bread. And that's exactly what we've looked at. These 3 cores or pillars, which is strategize, connect, invest, is what we've worked on for this year.
Technology is driving the industry forward, creating faster, smarter, and more efficient services. But experts caution that innovation must not come at the expense of human connection.
We need to embrace technology fully, not partially. So the full framework of it, which includes, yes, we adopt the technology, but the privacy side, invest in our IT teams, invest in protecting actually security systems that actually protect the data so that people can't break in anyhow. And then also train the people that are collating or whether collecting, storing, and engaging with the data.
However, areas we need technology in terms of services, like I mentioned, lighting, water, checking in, checking out. But when it comes to emotion, human feeling, we can't automate human feeling. We can't automate how people perceive things. We can't automate how people even perceive that service.
Culture remains a cornerstone, with calls for African hospitality to reflect local identity while remaining globally competitive.
Our culture should be infused in everything. And what's our culture? The way we respect people, the way we greet, our food, our organic food, the way we serve, our fashion, the way we dress, everything is unique. and it can be adopted.
So let's be proudly local. Why not? What's wrong with it? If you look at Nigeria right now, dominates music, dominates movies, dominates fashion. There's probably not a capital city in the world that can't get jollof rice in it. So why are we so obsessed with wanting to be like other countries when it comes to hotels?
The consensus is clear. The future of hospitality lies not just in offering rooms, but in delivering unique and memorable experiences. In Lagos, for News Central, Victor Mbadike.
Away from Nigeria for a bit, hundreds of young protesters have taken to the streets across Morocco in some of the largest anti-government demonstrations in years, demanding urgent reforms in health and education. The grassroots movement Gen Z 212 has led rallies in at least 11 cities, including Casablanca, Rabat, Marrakesh, and Agadir, calling for better public services and an end to corruption. Authorities responded swiftly, arresting nearly 200 demonstrators since Saturday. Human rights groups have condemned the arrest and called for dialogue with the young activists. And a headline story: following Gaza peace talks with Israeli Prime Minister Benjamin Netanyahu at the White House, U.S. President Donald Trump says a deal is beyond very close. While Hamas says it has not formally been sent the 20-point peace plan released by the White House, Trump says that Netanyahu will have U.S. backing to do what it has to do to destroy the group if it does not agree to the plan. The scheme proposes an immediate end to military operations, with Hamas releasing 20 living Israeli hostages and the remains of the more than 24 believed to be dead within 72 hours. Israel would then release hundreds of detained Gazans, with aid immediately sent into the Gaza Strip. The plan demands that Hamas will have no role in governing Gaza and leaves the door open for an eventual Palestinian state. Earlier, the White House reports said Netanyahu called Qatar's leader and apologized for Israel's strike on Doha earlier this month. We'll go to a short break, and on the flip side, we have business, sports, and entertainment news. Do stay with us.
It's time for Business Tonight. My name is Chamun Dabeng. Nigeria's Civil Aviation Authority says it is considering certifying China's C919 jet for domestic carriers as Africa's most populous nation eyes aviation expansion. Built by Chinese plane maker Comac, the narrow-body jet competes with Airbus and Boeing, but lacks Western certification. Director General Captain Chris Onanajomo said discussions with Comac include maintenance, training support, and dry lease arrangements. The aircraft may also feature at Nigeria's first international air show in December. Aviation Minister Festus Keyamo has welcomed Nigeria as a potential hub for Comac in Africa. Local airlines, including NG Eagle, express interest if certification and operational support are assured. Cocoa prices edged higher on Monday, buoyed by slowing export growth from Ivory Coast, the world's top producer. Government data shows farmers shipped 1.8 million metric tons so far this season, up just 3.4% from last year, below December's 35% surge. Support also came from shrinking U.S. port inventories, now at a 5-month low. Still, demand concerns weigh heavily. Chocolate giants Lindt, Barry Callebaut, and Mondelez have cut guidance, citing weaker sales and high input costs. Looking ahead, optimism around Ivory Coast's main crop due next month in Ghana's harvest could add pressure. Meanwhile, Nigeria projects an 11% output drop in 2025 and 2026, further complicating global supply dynamics. Now let's move on to the stock market report. The all-share index closed today with a modest uptick as investors pivoted between bargain hunting and cautious profit-taking. Dynamic activity in banking and consumer sectors stood out, even as currency headwinds and global rate whispers muted gains elsewhere. Now let's take a look at what's going on. The all-share index closed today at 142,377.56, and it was up 0.17% today, and the market capped out at 90.12 trillion naira. Now let's take a look at sectoral performance. Well, today's sectoral performance report shows a very struggling sectoral performance today. Well, taking a look at banking, it was up 0.47%. Insurance took the hardest hit today, down by 3.43%. Oil and gas was also down by 0.51%. Consumer goods was down 0.58%, and industrial goods came up at 1.59%. Well, that's a wrap on business tonight. My name is Chamunda Beng, but don't go anywhere, because coming up next with sports is Favor.
And in sports, South Africa's bid to qualify for the 2026 FIFA World Cup has been rocked after FIFA handed down sanctions for fielding an ineligible player. Midfielder Tebogo Mokoena featured in Bafana's 2-0 win over Lesotho in March, despite being suspended for an accumulation of yellow cards. FIFA's disciplinary committee ruled the match a 3-0 forfeit in Lesotho's favor, fined the South African Football Association 10,000 Swiss francs, and issued Mokoena a warning. The ruling reshapes Group C, with Benin Republic moving top on goal difference ahead of South Africa, while Nigeria and Rwanda just 3 points behind are back in contention. Only group winners qualify automatically for the finals, and Benin travel to Rwanda and Nigeria in October, while South Africa face an away game against Zimbabwe before hosting Rwanda. The South African Football Association expressed deep disappointment at the ruling and vowed to challenge it. Still talking football, the Nigerian Football Federation has confirmed that the Super Eagles will play 2 high-profile international friendlies in the United States during the November 2025 FIFA window. On Friday, 14 November, the 3-time African champions will battle Venezuela at the Shell Stadium, Houston, with kickoff set for 8 p.m. local time. 4 days later, on Tuesday, 18th November, they will confront Colombia's Los Cafeteros at Citi Field, New York, also at 8 p.m. Eastern Time, of course, 1 a.m. Local time. Now, both games are seen as test games towards the 2025 African Cup of Nations set to take place in Morocco between the 21st of December and 18th of January 2026. Nigeria last taught in the United States in 2022, losing 1-2 to Mexico in Dallas before falling 1-0 to Ecuador in New Jersey at Jose Pesiero's first matches as head coach. And now to the under-17s, Nigeria's Golden Eaglets will battle Ghana's Black Starlets in the semi-final of the WAFU B Under-17 Championships on Tuesday at the Stade Charles Konan Bani in Yamoussoukro, Côte d'Ivoire. The 5-time world champions topped Group B with 4 points, scoring 4 goals and conceding once in 2 games. Ghana struggled through Group A, drawing with Togo, losing to host Côte d'Ivoire and edging Nigerian Republic 3-1 to progress. Nigeria hold the edge in recent meetings, winning their last 2 encounters at the 2022 edition. Our victory will secure a spot in the final and qualification for the 2026 Africa Under-17 Cup of Nations, reinforcing Nigeria's dominance in youth football on the continent. Kickoff time is 8 p.m. Nigerian time. And a bit of update on the Flying Eagles is 1-0 in favor of Norway, halftime in Chile. And that wraps it up on Sports Update. I'm Favor Itua. Up next is Entertainment with Sam Dandy.
Time for entertainment with Sam Dandy. Let me do it the way you guys do it.
So much has happened in entertainment, but yes. I got the hottest story of them all. This one, people are still talking about it in New York Central Park. Nigerian superstars Sabi girl Ayra Starr, rave lord Rema, and South African global sensation Tyla each brought the fire at the Global Citizen Festival 2025. Ayra owned the stage with back-to-back hits like Rush, Bloody Samaritan, before Tyla got the crowd dancing to her global smash hit, you know this one, Water, and Truth or Dare, amongst other hits. Now, Rema then made a big, iconic entrance, joining Ayra Starr for the global smash Calm Down, and together they did this incredible version of the soulful cover of Sade's Is It a Crime? The night was just about, well, not just about music, of course, it carried a message. At one point, the crowd lit up the park with phone flashlights, symbolizing a pledge for renewable energy in Africa, and honestly, the incredible stars we have. So let's watch this.
New York, I love you.
This is New York City, not Nigeria, and these are our stars representing, of course, and they're young.
Yeah, I was about just shaking to it when it went on.
What a time to be alive. Well, congratulations to them, and we look forward to seeing more young stars do incredible things here out of Nigeria. Those are the biggest stories in entertainment. I am Sam Dandy.
And just in tonight, the federal government has called off the parade that was planned to mark Nigeria's 65th independence anniversary on October the 1st. This was expressed in a statement on Monday by the Director of Information and Public Relations at the Office of the Secretary to the Government of the Federation, Segun Imohiosen. He said that the government remained committed to celebrating Nigeria's 65th independence with dignity and enthusiasm. According to him, all other programs lined up for the anniversary would go ahead as planned. And that's the news tonight. Do send us your eyewitness report. The number to do so is now on your screen. We'd love a follow on social media for updates if you'd like at News Central TV. You can watch us live on DSTV channel 422, GoTV channel 23. We're on Star Times 274, Avo TV, and on YouTube. Thank you very much for watching. Have a good night, and I'll see you tomorrow.